Welcome. This is the Second Opinion Sports Medicine Podcast. I'm Dr. Dhokal.
I'm Dr. Glass. Good morning.
Good morning, man. Happy Friday to you.
Yeah, happy Friday. Yeah, we made it through another week. What the heck?
Dude, it's been a week too, hasn't it?
Yes, sir. Yeah, man, trying to get this done. I not that I don't want to, or I get excited. I wish we could do this every day, obviously.
Right.
But I was kind of stressing that we weren't going to get it in, so I'm glad we both made it happen today.
I mean, it was a busy week with the Super Bowl last weekend, and then I know you're a lover, so Valentine's Day probably you had days of planning, I'm sure.
Yeah, I got all the girls, man. I gotta take care of everything. So
Yeah, what's
good.
Valentine's Day like when you have 4 females? You have to make sure that they know that that they're loved.
Yeah, a lot of planning, a lot of planning. And now I got my daughter in Tennessee. I got to make sure. Last 2 years, I had to elicit some help from some of the parents, one of the moms out there, to get it done for me. So I give her a list. She graciously goes to Walmart or Target and picks out the things I want. And her daughter helps me out and has it ready for my daughter the next morning. So
Dude, that's super nice. That's good planning on your part.
Yeah, it's not as easy as you would think to, go online. You'd think, oh, no problem, shop. But then half the time, oh, not in the store. Or, it's like, even though I asked for the ones in the store, by the time I go to checkout, not happening.
Right.
I'm trying to do it in between patients, trying to get it done late at night, so you would think it'd be easier, but it's not.
It's easier than it used to be, where you can order stuff online or have stuff sent to your house. But there's a little planning required, huh?
Yeah, and it's a lot easier if you plan a couple weeks, a month ahead, not the night before or the day before. So my own worst enemy, it'd be way easier but I had planned, I planned in my head, but the days sneak up and then it's like, oh man, got to get it done.
It's true, man. It's sometimes days feel like Groundhog Day, and sometimes even when they don't, like you're busy doing other things. I feel like there's some days where we're probably in contact with 20, 25 people dealing with people's injuries or pain points. And then also, you spend a considerable amount of time with your patients as well. You're not like a 2-minute, 3-minute adjustment and they're out the door.
No.
And so, you have interactions and conversations. And, at the end of the day, sometimes you're like, man, I've had 25, 30 conversations that have been in depth and important. And there's some days that it fatigues me more than other days.
Yeah, for sure.
So it doesn't leave too much extra for things like extracurricular things. Some days you get home and you're like, man, it's the end of the day. And there's no more time.
Yeah, you just want to shut off.
Yeah.
Compress, don't talk. That's what a lot of times people don't understand, that you go, and then like to go, like sometimes I'll get to my daughter's game right after, and I'm my adrenaline's going back to back patients, or I just finished a patient that a tougher case maybe or something, and you get in the car and you drive 15-20 minutes to the field, your adrenaline's kicking in, and then by the time you get there you're toast, and then it's really hard to flip that switch and try to talk again, or to engage with people. And a lot of times I feel like a jerk, I just don't want to talk. I'll go down the sideline, especially with my parents. I feel terrible. A lot of times I'll get there and I just have nothing left in the tank. And, and obviously people, it's their first time seeing you for the day. And so they're excited and want to talk to you and get caught up, and I'm just toast. I got nothing left. So, it is a struggle. So I try to work on it. I try to mentally prepare for that on my drives home or drives to a facility. And, but I think that's a lot of things people don't see from a healthcare standpoint. We're putting out fires, every patient that's coming in, we're taking on their, heat and we feel for them. And so it's not as easy as people think to turn it off.
How do you like manage that, I guess, is my question, because there are definitely weeks where I feel a little more fatigued. Usually my energy is pretty high. It's like, what the expectation is for the day, like, hey, I have a dozen patients or 25 patients, whatever the case may be, maybe less, maybe more. But yeah, man, there's times where I feel like I've used all my words up for the day.
Yeah.
And
yeah, for sure.
There's a little bit of I don't want to say draining talking to patients. That's not the right way to articulate it, but for instance, like yesterday I had two patients, one who had a family member who got diagnosed with cancer, and yesterday I had somebody come in who was diagnosed with cancer a few months ago. I want to talk about that case a little bit later on, actually, but it's heavy stuff. He's coming in telling me about his fears and his concerns, and I know his two young boys, and that's not happiness.
Yeah.
That's heavy, and we're trying to figure it out. And so there's days where I come home, and I think what I'm missing is the time when I used to come home and walk my dog.
Yeah.
Because
Yep.
I realized that's decompression for me. I'd come home, and before I heard about my wife's day or the stuff that's going on with her work, which is intense, and it's a lot as well.
Yeah.
I'd come home, take Kuma out, and get that 20 minutes of oxygen and sunshine. And also, she never talked back. Like she
Yeah.
just heard it all and loved
Yeah.
me no matter what. And so,
Unconditional love right there. Yep.
yeah, man. And it's just the time too. I realized that coming home and taking that time to walk and just clear my head and have that separation between work and home. The commute is okay, but my commute isn't that long, and
Yeah.
a lot of times, probably like you, I'm calling back a patient or taking care of something on the way home. Or so anyways, it's a good decompression time. And I think I kind of miss that. So I need to carve in like a new habit, either a solo walk or go to the gym for 20 minutes, something.
Yeah. Yep. Easier said than done.
Easier said than done, man.
Yeah. Yeah.
How's your energy been the last couple weeks, the last month? Is work in 2024 on the up and up? Is it uphill? Is it like, how are you
It's
been feeling?
it's been draining. I'm
Yeah.
not gonna lie. Yeah,
Yeah.
it's been a grind. Yeah, yeah, not smooth sailing for sure, but you know, that's why they call it the grind, and one step in front of the other. And I keep remembering, the slogan you sent me, that sweatshirt, better than yesterday. So
Yeah.
and I'm super grateful every morning to wake up, open up those windows, windows to heaven, and
Yeah.
just give my gratitude and thankful. Start the day off that way, and then take it on.
There is something to that. It is, I don't know if it makes a difference or not, I'm not sure, but I have noticed I feel a little bit better when I wake up in the morning and I remember to just think of the things that I didn't have before that I have now.
Right.
And even the things that I had before, things that I'm grateful for, and just taking, shoot, man, 30 seconds to be like, man, I woke up today. I feel good. I'm healthy. I mean, coming into contact with people every day who don't feel their best, either they're in pain or the last couple of weeks, people have been coming in sick. And then major issues like cancer, family deaths. I do really get up and I try every single morning to remember and be like, okay, I feel good today. I'm thankful. I feel good. I'm, young, happy, healthy, and hopefully I do some good today. And I don't remember that every single day, but I dang near try to make it a habit. I have a little Post-it note where my toothbrush is that lists a couple different things that are important to me, that are reminders, so at
Yeah.
least I see it when I brush my teeth in the morning and in the evening. I used to just read it, and nowadays, and then I went from reading it to like just saying it in my head,
Mhm.
now I actually say it out loud every morning.
Yeah.
Just, hey, I'm thankful for this, and I'm grateful that I woke up and I'm healthy today and I feel good. Hell, even on days I don't feel good, I say,
Right.
okay, I'm, I'm not sick in the hospital,
Right.
and yeah, that's it. I think it's just a recognition. And hell, I don't know if it makes a difference, but I do think that your body listens to your thoughts. And I think if I think of, throwing a center release touchdown to you, that makes me happy and
Mhm.
evokes certain emotions and creates a chemical cascade in my body. Or if I think of, Kuma and how sick she was, that creates a different chemical cascade in my body and changes my hormones and how I feel, my emotions. So I think the opposite's true, where if you say positive things and you reinforce the things that are good, I think your body hears that. So I
Yeah.
know it doesn't do any harm, Do you do you think that's a little hokey or cheesy? What's your thoughts on that?
No, man, you know me. I'm a big believer in all that, and it's really important. We got to be careful what we say, because either way, it's going to be true,
Dude,
So,
so true.
I recently was listening. I listen to a lot of podcasts, a lot of ministry type stuff, a lot of sermon type stuff, a lot of motivational, all that kind of stuff. I just kind of try to fill my head with that instead of the news or music or whatnot,
Sure.
and heard a good, somebody was dealing with cancer, and we're talking about cancer, but
Mhm.
was dealing with cancer, and when they asked how you're doing, she would always reply, I'm healing,"
Oh,
versus
nice.
I'm sick. So like even if you have a cold or flu, oh, I'm really sick, I'm really, not feeling well. The narrative should be, I love that because
Yeah,
you're healing,
writing that down.
you're allowing, so regardless. So I've even tried to implement that with my patients, and how's your low back, so the first knee jerk should be not that it hurts, that I'm in the process of healing, so there's a little twist. Like, it's so powerful though, right? So instead of starting the conversation off with everything that's not going well, the fact of healing doesn't say you're feeling good.
Yeah,
It doesn't say that you have no pain. It says that I'm in the process of getting better. I'm
getting
healing.
better. Yeah.
Yeah, so getting better than yesterday, or better than yesterday. So I had to remind a patient of that yesterday. She goes into like, oh, I'm doing so much better. I can do this, this is this, but I still
Mm,
have the pain right here. I'm
yeah,
like, no, the process is not pain, no pain. The process is we're gradually getting better. You're improving. So let's cut out that butt of it and
yeah,
say, I'm getting better. Because you just went in and told me all this, but as soon as you said that but, all your mind and everything went to the one thing, the last 20% that you're still not happy about. And I told her, I said, I get it. I said, we
yeah,
want that out of there. But the fact that you've come from this point to this point in just a few weeks is huge.
yeah.
You no
Let's
longer have
recognize that.
constant pain. Yeah. So I had to remind her of that, because that it, I don't want to say drives me crazy, but when patients do that, and it's very common, it's human nature, to throw that butt in there, and forget that we're actually healing, and it's a process. It's not a light switch, right? So the way the body responds is a process of slowly adapting for long-term results. We're not injecting we're not cutting anything out, we're not burning anything, we're not mechanical in that nature. It's a process of healing, and
Yeah,
that process has a dimmer switch on it, not a light switch. So people got to remember that. So instead of saying black or white, let's have that dimmer switch.
I like that, the dimmer switch, because that
Mm-hmm.
really, you can right away in your mind's eye see that it's gradual and it's
Mm-hmm.
not a flip of the switch, like you said. I'm
Yeah.
going to borrow that. And I think there's a distinction between what you said of somebody saying, hey, I'm feeling better, because that doesn't always seem authentic if you don't feel good,
All right.
But saying I'm getting better,
Yeah.
now that's something.
Mm-hmm.
And yeah, I really do think the way that you frame things matters. And I've been thinking about that more lately in the last few months. And yeah, all things are equal. It could be, fourth and goal, and you could be like, shit, we've blown 3 downs. We suck. It's fourth down. We didn't get that score. We didn't get the first down. Or you could be like, it's fourth down. We got one more chance.
Yeah. Yep.
And it really is perspective in certain things like that. And, with my patient who came in with cancer, if we can kind of jump into that case here,
Yeah.
it was interesting because I expected him, my massage therapist saw him about a month and a half ago and hadn't seen him in like 4 months. And her comment was, whoa, Dr. D, he doesn't look great, like he's lost a lot of weight. She's like, it was really kind of like shocking to me when I saw him, like it took me aback. And so when he came to see me to schedule an appointment, I was really preparing myself to see him pretty sick. And he came in, Dustin, and his color was good in his skin, which might sound like a funny thing to people to hear,
Yeah.
but I've seen people not look good, like really
Yeah.
pale and just really sickly, bags under their eyes. His skin looked good. He looked good. He'd lost weight, but he wasn't frail. And what struck me was he came in and gave me a big smile and a big hug. And he's like, man, it's so good to see you. I said, how are you doing? And he goes, well, I've been better, but I'm getting better. And I was like, dang, that's good. That's good to know. So then he went into like the last 6 months. And if I summarize it, he had low back pain that was unresolving, and we couldn't, figure it out with the traditional things that we would do, right? I mean, someone comes in, you're like, exam, let's adjust if that's appropriate. We did everything from soft tissue work, cupping, referred him out to acupuncture, took imaging twice. Nothing revealed upon imaging except for some structural deviations. Nothing that's like, man, you should be in continued pain that's unresolving. And that was the key, was it just wasn't getting better. So we took x-rays once, wasn't getting better. We took x-rays again, still the same pain. And now he's saying it's not just back pain. He like can't sleep at night. He's sleeping on the floor to hopefully relieve some discomfort in his back. He still thinks it's his back and his hips. So before I get too much into it, have you had a similar experience with a patient who, you thought initially maybe it was simple mechanical low back pain and maybe it was something more significant?
Yeah. So a few months ago, had a kid come in, and long story short, he had been to several he's had every imaging done, everything done possible, blood work, everything,
Mm-hmm.
nothing showing up. So by the time I got him, he had already had a laundry list, and it had been a month or so of this excruciating pain radiating down his leg. Um, you know, that you can make an argument for sciatica, but there was a little something different about it.
Mm-hmm.
So I went through the checklist with him. I saw him one time, and I talked to him about, listen, the good news is you've ruled out the anatomical stuff. We knew he had a bulging disc, so we had bulging disc on there. So we go through the list. Is it mechanical? Is it anatomical? Or is it systemic in nature?
Mm-hmm.
So I tell people it's usually one of those three things. I said,
Can
you've
you
come
break
in
that
with,
down real quick? I don't
yes,
mean to interrupt, but I think it's
yeah.
important.
Yeah, so we go through the list. Is it anatomical? So that's where an X-ray, MRI, CT, some kind of imaging will show something structurally going on in your low back, in wherever the problem is. Is there a disc? Is there a nerve impingement? Is there something we can visibly see as the cause on imaging? So that'd be on the anatomical component. The next component would be the mechanical side. Is there something in an orthopedic exam where or doing muscle resistance testing, not muscle testing, but active and passive range of motions, movement screens? Is there something in the biomechanics that are not functioning right, which shows an imbalance, which would cause some of the pain, a tracking issue or some sort? So mechanical in nature. Is it the muscle more than the other issues? Then the third one would be systemic. Is there something in the bloodstream not allowing the muscles to fully contract or relax, or the nerves to fire too much or too little, or just a pH imbalance, a blood sugar imbalance, a
Mm-hmm.
nutrient imbalance that aren't allowing the system to work efficiently the way it should? So we want to go through that checklist. Well, he had done that checklist. He had extensive blood work. And nothing showed up. He'd been doing PT. The PT was not working. So we knew there were some mechanical issues. He did have a little disc bulge that would correlate with where he was having the pain, but the pain scale was not matching up with traditional disc stuff. And the kicker was that the nighttime was the worst when he was laying down. It was terrible.
Mm-hmm.
So that was the biggest red flag, right? But as a first visit, I went into, okay, because he had had all the blood work out, he had all the imaging done, nothing showing up. It was still early enough to say, well, let's try some different types of therapy before we jump
Sure.
into worrying about the cancer, right? Well, it was getting really excruciating bad, and some days were better than others, so it would change a little. But it got to the point where mom, in the meantime, took him in. Like the next day, they already had an appointment with another ortho, and they took X-rays of his lower leg where the pain was ending, right?
Mm-hmm. Mm-hmm.
And sure enough, there was a bone mass in his
Yeah.
lower leg, right? And so thank goodness. And she called me the next day. I'm saying, thank goodness we talked about getting some, following through if things weren't responding. The
Yeah.
normal traditional, what you say, hey, let's give a due course, because you
Yeah.
don't jump right to that. So and she was thankful, and so instantly sent to chalk, sent to oncology, all that because it looked like a pretty significant. Well, within about 72 hours of total emotional roller coaster, it came to find out it was an infection of the joint
Wow.
that grew into this mass that looked cancerous. So they went from holy crap, going from this, and it was a pretty bad cancer that
Mm.
that
Without that thought it
the
was.
survival rate was not great. To
Mm.
now, all within like 3 days. Talk about
Dude.
emotional for this 17-year-old kid, senior.
And the
So
parents.
oh, it was, yeah, and so it
And
was
you.
pretty, yeah. I was, yeah, because we live it with them. So, so it turned out, so then they started, working on the infection. But the crazy thing is, because in my history, we were talking, was there any site, any infection site, any fever? Nothing, nothing. No
Nothing.
blood test showed it.
Yeah.
Nothing. So the doctors were baffled too. It was, and even the oncologist said it was cancer. So it was just one of those cases where nobody missed anything, and that's what I kind of explained to the. It was just you had to go through these tracks to but kind of a learning point, and it normally you would not do this, and it followed the right timeline. Is we can't forget at some point in the timeline you got to take a picture of the actual site when there's referred pain like that, and that
Yeah.
was the biggest culprit. Okay, well, we took a picture of the low back, x-rayed the low back, took an MRI, we see a disc bulge, referred pain down the leg because it mimicked just like sciatica.
Yeah.
Okay, well, when the treatments aren't working, and usually we go about 12 sessions, before making because research shows it takes about 12 sessions to get somebody 50% better.
Hmm.
So we have to run that course. Well, if something's not adding up, let's take a picture at the actual site. So that was a good reminder to me, like, keep that timeline really tight,
Yeah.
and don't let it go too long.
There
So,
was two things that you said that struck me as worth repeating. One is 50% better in 12 treatments.
mhm.
I've often had people come in and they have some issue, and you're one or two treatments deep and they feel much, much better,
Yeah,
and those are the ones that we love because it's like really rapid improvement. However, not every case is like that. And I got to be honest with you, man, there's times I'm guilty of kind of forgetting about that. On average, it's about 12 visits
mhm,
for, say, mechanical low back pain or sprain strain
mhm.
syndrome type of issue. And I'm like 6 visits deep and they're, better, but not, I call it significantly better, which is like 80% or more to me. And then it gets frustrating. It's like, man, what are we missing? And sometimes
Yeah,
you're not missing anything. It's just there's a runway of time, that there's natural healing, right?
yeah,
You're not going to heal a broken arm, 90% faster. There's things you can do to increase the healing time and maybe improve that, but not 90% better, And so
right.
I forget that myself and sometimes get a little frustrated when things are a little more pragmatic and slow versus, quickly. So
Well,
yeah, sometimes I got to taper my expectations.
one thing I had to learn over all these years, we're in the sports medicine world. So my first phase of my practice was all pain management, right? Like we
Yeah.
just want to get you out of pain and get you back on the field. So our timeline was a lot shorter. It should be 1 to 2, maybe 3 treatments, and you should be go. Now that doesn't mean they're well. That
Yeah.
means they're out of pain. So,
Yeah.
but I would take that into my practice with the average person and have
Yep.
those same expectations, right?
Right.
Where so I would expect them to get better within a few because I'm doing it on the field. I'm doing it in the locker, the training room.
Yeah.
And so but what I had to learn, and one of my mentors reminded me, like on that research, he showed me the research, and this was years of research, not just one study. It
Yeah.
was over many years and many patients that the average was 12 visits for low back pain. And then it increased. They were able to show me research that that's just for young, probably
Healthy.
somebody
Yeah.
from young, healthy, and active. Now you take somebody with any kind of degenerative change in any part of that area, you're going to increase that treatment plan by probably about 12 to 20 sessions
Hmm.
because you're working on a degenerative changes. It takes minimum 12 years for degenerative changes to even show up on an x-ray
Right.
minimally.
Yeah.
So if you want to make a lasting change so it's not doing this every 3 months to 3 year cycle, you have to have more than the treatment plan is going to be about 24 to 36 visits of care and progressive rehab. It doesn't mean it's going to take 12 to 36 visits to feel good. We're
Yeah.
going to get you feeling good probably within 6 to 12 visits where you're going to feel like I have no issues. That's the time where we put our foot on the accelerator and start our progressive rehab, neurologic reeducation, and get all the muscles around that area to fire so we don't have this relapse in the stats show. If you don't continue some kind of care, within 3 years you're going to have another really bad episode.
Yeah.
So that's just what that's proof. So we have to remind our patients that we don't want you to be a statistic and have this. We don't want to do what everybody else does and just get you out of pain and then have you keep coming back. Let's
Yeah.
put in the time now, put in the energy now, and get you well so you can take on life and not worry about your back, going out. And if it does, because life happens, you're going to respond quickly within
Quicker.
days to weeks
Yeah.
versus this 6 months that you've been dealing with it or more.
No,
So
100%, bro. That's that's spot on, and I had a runner, this was last year, so a few months ago. And I made the analogy to him similar to what you said, but I said it differently in that, he'd lost his cardio and was like, man, my wind sucks right now. And he had an injury. And, essentially he hadn't trained the way that he'd like to train for a couple of years. And he was on the road to getting back, excuse me, to where he was to be able to compete. And I said, man, you took a couple years off, and like, did you get back to, performance or competition status after taking a couple years off due to injury? Did you get back to competition status in 2 training sessions or 2 weeks of training? He's like, nah, man, it took me months. Like, I'm still in that process, And I kind of made the parallel of like, well, you've had this issue that wasn't like you slipped off a curb and broke your ankle and it happened instantaneously. This is a long-term thing. I said, how long do you think that this thing took to develop to the point where you're like, I can't train anymore, I can't compete anymore, this is impeding the things I want to do with my life? And he said, I know what you're getting at, probably years, right? And I said, most likely over 5 years, getting
yeah,
to your 10, 12-year point. I said, so if it took 5 years to get there, if you're driving to a destination and it took you, 5 units to get there, why would you think that to get back, it's going to take you 2 units or 1 unit, If
yeah,
it took you
that's a
5
good
years
point.
to get there, you should have the mindset of it might take me 5 years to get back to pre-injury stat.
Yeah,
And I also said, I don't think that's the case, but you got to have that mindset. He's a
right,
runner. If you go out and lace up your shoes and you think you're running a 5K and all of a sudden you're running a freaking marathon, that's not the right mindset when you go out. And he's like, okay, I see what you're doing. Like,
yeah,
I get it. And with somebody else who's a mom, she's a baker, so I try to like make analogies that people can relate to a little bit. And I said, look, you're a baker, right? Yes, I am. I said, when you make that delicious cake you brought me a slice of last year at Thanksgiving, um, there was layers to it, right? And she goes, yeah. I said, this is like your pain. What we went through is like the icing on the cake. We got through the pain portion of it, but that's not it. We got the whole cake to go through. And you're looking at the icing that we cut through as like, we got the whole slice. Like, nah, girl, we got a lot more still there. Getting out of pain is step 1 here. Sometimes it's the final step for people. I just want to get out of pain. And when I relapse, I'll be back. I definitely have that demographic of patient, and that's fine. We're there when they need to come in. But she got kind of giddy with it. She's like, oh, well, I hope that was a thick icing. And I was like, well, we did get through a lot, like
yeah,
she had a lot to get through, but it's important that people recognize that I think health is a journey is I guess what I'm trying to say,
yeah,
not like just I feel good today and now I'm done training.
right.
I had a good workout 2 days ago. I didn't go yesterday. I'm going to go today. And like, I got to keep at it. Otherwise you lose it.
Yeah, no, those are great analogies. You did, yeah, I love those. So, yeah, I'm going
Yeah,
to use those.
it's important, man. I think
Yeah.
I should do a better job of explaining to patients certain timelines. I do think it is something I should be a little more aware of, because I do take that pro athlete mindset into everybody. And I expect, not everyone has the physical gifts that pro athletes do, whether it's being in great shape or whether it's great cardio, whether it's great mindset, whether it's overcoming adversity and obstacles. And so you have this ingrained in you that you can achieve.
Yeah.
So to have those expectations for, stay at home grandma or something is just not the same. And
Right. No,
I got to be better at reminding myself of that, I think.
yeah, I had a new patient call. Well, she was a hyperbaric patient called in and wanted to do hyperbarics for Decompression syndrome. That's a
Yeah.
tendinopathy of the thumb for those that don't know. But and so she was kind of giving me her story, and she just started with she had done PT 3 times and
Mm-hmm.
it didn't work.
Oh,
Three
geez.
times. So,
Okay.
and then she just had an appointment with a ART doc that she was going to start with. So she went to one session, and I said, "Oh, great, that's going to be perfect. That's one of the best things that you can do for this. Is if because I don't know your case, I said if it is mechanical in nature, that's going to be one of the best things you should do. I'm so glad you're doing ART. Stick
Mm-hmm.
with that. I said just so you know, it's going to take about 12 to 36 visits to fully get you returned.
Yeah.
And I
That's a
was
big
putting
number for people, right? When you say
I was
that.
putting it on and she wasn't my patient, so she was another guy's patient. So I was trying to help this guy out
Yeah.
by saying, "Hey, listen, this what I want you to hear." And I told her this. I said, "Now I don't think it's going to take 12 to 36 visits." I said, "But I want you to hear that this takes time." And
Yeah.
she's all, "No, I don't want to hear that." I said, "I understand. She's been dealing with it for 8 months." And she's all, "I don't want to hear that." She's all, "I thought honestly that it was going to take 1 or 2 visits of ART because that's
Mm-hmm.
what I've heard it does." I said, "Well," I said, "I'm going to be super honest with you." I said, "It's going to take a lot more than that. You got to have a higher expectation so you're not disappointed." And I said, "So
Yeah.
have that conversation with this guy. What has he told you?" "Well, we haven't talked about it yet. I just had one session." I said, "Okay." I said, "If he recommends quite a bit, just know that's the norm. Okay. Don't feel like that's, too
Yeah.
much." Or I said, "You need to put on time." Well, come full circle. She came in for hyperbarics and everything. We were talking, and she wasn't given any kind of homework to do or anything. And she then asked if she could become a patient of mine so I could work on it.
Mm-hmm.
The good news is, in her mind, she already knows it's going to take up to 36 visits.
Yeah.
So I've already set the expectations, and she still wants to come in. And so I think it's huge, right? So I'm not trying to pull patients from anybody. And because even on her first visit, I was still encouraging, and she was walking out the door and came back and asked if she could, sign up. I said,
Yeah.
"Yeah, I'm not going to say no, um, but my point to that was that her expectations, she knows that it could take time." And I told her, I said, "I want it to go away as fast as we can, right? The pain to drop." I said, "But once we get that pain drop, then we're going to start strengthening it." So,
Yeah.
yeah.
That's that happens sometimes.
Yeah. And people are going to hear that 36 visits. Again, there's no magic ball. A lot of that's based on research and a lot of that's based on spinal stuff. And I have the full conversation. I go full circle with them and I do explain to them that, what, this is going to take a lot less than that. But my point is, I just want you to hear that this takes time.
Yeah.
And so anybody listening, a student or whatnot, or another doc, man, that's a huge treatment. What is he talking about? He doesn't know. There's more conversation to it than that. But yeah.
It's just setting expectations and giving them like a little bit of a framework. I think that's important, because you never know how someone's coming in. Like,
Right.
it's a reminder to me to check in with the client or check in with the patient. I mean, we do that with our athletes naturally, like, right? Like, what is your expectation? Are you trying to play on Sunday? Like, it's Tuesday. Are you
Yeah.
trying to play on Sunday? Because if you are, let me know. And if you're already in your head, or the team trainer has already said, hey, you're sitting this week, okay, that gives me a longer runway. Like, I need to know that.
Yeah.
And so, yeah, having, somebody walk into your office and in their head, they're like, hey, we've heard Dr. Glass is awesome. I've read his reviews. He treats some of the best people in the world. Surely he's going to get me better in a treatment or two. And if it's a 4-session, 5-session thing and they have a 1 or 2 expectation thing, it could really be a 12-session thing and you're amazing and do it in 6, and their expectation is 2 and you do it in 6 and they think you suck.
Yeah.
And you're like, I'm amazing. I did it in half the time of average, you know? So that discussion is easier visit 1 than it is visit 5 or 6.
Correct.
Yeah.
Set it up right. Set the
Yeah.
layup.
No, those are good little reminders, even for myself. You know, it's good to refresh those thoughts and know that everyone's coming to you in a different mindset, in a different place, with a different expectation.
Correct. Yeah.
Well, I've prolonged it as long as I could, my friend.
Let's get into it.
We're at this part of the podcast where I have to bring up what happened last weekend on Sunday.
Yeah. Yep.
My 49ers have lost their 3rd Super Bowl in a row, which is terrible. The second time to Patrick Mahomes and the Chiefs, which as a Charger fan is even more terrible.
Yeah.
And I'll say that this Super Bowl loss for the 49ers stings a little bit different. The last time we played the Chiefs, we lost. Jimmy Garoppolo missed a wide open throw to a receiver that could have sealed the game. We had a 10-point lead going into the 4th quarter. Once again, we had a lead going into the end of the game, and the Kansas City Chiefs are world champions for a reason. They have one of the best quarterbacks, arguably, running the show on the offensive side in Patrick Mahomes. And, man, they did just enough to beat the 49ers. And I'm going to stop talking there. And I'm curious as to what you thought about the game, because I have a lot of opinions and thoughts on the sports med side and on the coaching side. But I feel like I got punched in the gut every time I think about it, you know. But what are your thoughts on the Super Bowl? How did you watch it? Were you happy?
Yeah, it was reminiscent of, watching Tom Brady. I was never comfortable with the lead that we had, 49ers had. I was happy, but I was never comfortable knowing what Mahomes can do, knowing what, Kelsey could do, seeing how fired up he was on the sideline. We've all seen that, how he went after Andy
Yeah.
Reid. But that's just passion. And, what people forget, you should not do that. It's uncalled for, but they know their relationship. That's nothing new to them. It's shocking when we see it, but and I heard Kelsey, he admitted he should not have done that. But Reid took it in stride, and I'm sure he talked to him, and he even said to him, he said, I don't know if you heard this, but he went up to him and said right after that, and he just reminded him, I have cameras all around me. Watch yourself. And so basically just reminding
That's what he said, huh?
he reminded me, I think he said something like, I have eyes on me at all times.
This is Coach Reid.
Yeah, during the game, as a reminder, just a subtle way to tell him, you better check yourself. Yeah, just know that everything is being seen. So, and I thought that was kind of classic. But again, like a father-son relationship, how to handle each player, each kid differently, and he handled it the way he wanted. It was nothing new to them. We've seen them have issues in the past when Kelsey threw his helmet down and Reid didn't let the helmet guy give his helmet back. We saw that on the sideline. Right. He told him he's got to cool down. So but knowing how passionate Kelsey was gonna figure out a way to get it done, do something, and he made a big play at the end, to get him closer. But so I was never comfortable. To answer your question about how I felt about the game, I was never comfortable. Never felt like we had it. We Niners. So
I think they did a good job of shutting Kelsey down, if that's what you want to call it. He wasn't very, I don't want to say effective, but he didn't have a lot of receptions, a lot of yards in the first half, and obviously second half that story changed. You could get into the coaching choices there, whether it was to receive the ball in overtime or whether it's to kick a field goal versus go for it on 4th down in overtime. My cousin texted me in overtime when we decided to kick the field goal after the 3rd down incomplete pass. And he said to me, Dan Campbell's going for it. Dan Campbell of the Detroit Lions, who just, has this foot to the gas pedal. And I said, well, Brandon Staley would have gone for it probably too, which
Mhm.
those are two different coaches with two different outcomes, but kind of the same aggressive mentality. And I was kind of not yelling at the TV, but I didn't like the choice of kicking a field goal against the world champions, knowing the new overtime rules of it being, hey, they get the ball, and if they score a touchdown, then it's game over.
Yeah.
It's really easy to second guess it, and I'm not here to put on the coaching hat, but I would have been okay if we went for it on fourth down and didn't get it, and then the Chiefs have the ball backed up, on their own 4-yard line and have to drive the whole way. They would have only needed a field goal at that point to win, but I just would have really wished at 3rd and 4 we would have either ran it twice and taken our chances, our best player against their weakness, or I wish we would have just picked up that block on 3rd down just for a millisecond, because we had the touchdown, so I can't fault Kyle Shanahan for his play call. The play call was right. He had 2 guys open. We just didn't have the protection correct, which it's unfortunate, and that's the game of football. So as much as it hurt to watch, it is why I love the sport. You need everybody to be on the same page. It takes like a synchronicity of movement of, at least 11 people to execute every single play. And, the layperson probably sees that as just an incomplete pass. And I look at it like, man, he had the slant on the left. He had that, we call it a slide out, or we used to call it a slide out, where you kind of pivot in and go the opposite way. And man, as a 49er fan, it just sucks. And then, the other side of it is the Chiefs are in the AFC West, the same division as the Chargers. And damn, I don't have a hat on, but if I did, I'd have to take it off because they're world champs and you got to put respect on that too, and I think there was a turning point in the game, which does bring us full circle to the injuries. Dre Greenlaw, man, one of our best linebackers, one of the 49ers' best linebackers, got hurt in a very unique, unusual way. It wasn't on a tackle. It wasn't on, a crazy hit. He was coming off the sidelines and tore his Achilles. And when he did it, I thought at first it was like a hamstring pull. And then he went, and I'm like, oh, shoot. Hopefully that's just a calf strain and they can tape it, biofreeze it, cryo it, and he'll be back on limping. And then it was his Achilles. I know you saw the play, but what did you think of it? Did you see it initially, and what was your thought? And then what did you see on the replay, which, you could see the calf kind of give.
Yeah.
So what was your thoughts on it when it happened?
Yeah. I thought it was Achilles initially. Just the way he went down, and then the reaction of his teammate taking his helmet off,
like,
and because when you strain your calf or your hamstring, you stay up.
Yeah.
You can, I've never seen a guy go down except for a soccer player with a cramp.
Yeah.
I see soccer players fold with cramp. I mean, they do go down. People do, but not a linebacker going in for the Super Bowl. He's not going to go down like that with a cramp. Yeah. He's going to hobble and try to walk it off as he goes onto the field, right?
Yeah.
With a cramp.
Yep. Of course.
But but you get the first thought I thought of, go back to the practice facility. You were telling us last week that, they were on this weird turf grass combo, and who knows, like the 49ers had way more injuries in that game than the Chiefs did.
Yeah.
And from what you had said, I don't think the Chiefs had the same kind of conditions for practice fields, because they made a big deal about 49ers having that condition.
Sure.
And there were a lot more lower body injuries for the 49ers where guys came out, not necessarily completely, but had to sit out a few. We didn't see hardly any of the Chiefs doing that. It's pretty interesting.
Yeah, no, it's I don't want to say it's disturbing, but you want things to be equal on both sides, and it's hard to make things 100% equal. But I think when the teams show up to Las Vegas and the Chiefs are playing on the field that the Super Bowl is going to be played on, and they're practicing on Allegiant Stadium field, the same turf that they're playing on. And then the Niners I think they're at UNLV on their field. And as I understand it, they'd laid down a grass field on top of a turf field. So they were practicing on grass, but the grass was on top of a turf field. It's not like it's been sodded in the earth. That's different, bro.
Yeah.
And the instability that's caused being on that surface, even if it's not like a direct, slip of inches, man, it makes a difference. And I think nobody can say for sure, but I will say with some confidence, I don't think that helped. I don't think they had the greatest practices all week long playing on a surface that you're not 100% comfortable. They're not going 110% Monday through Friday before the Super Bowl. So don't get me wrong.
Right.
Like the walkthroughs, all that stuff's fine. But for the team, the coaching staff, the players to come out and speak on it, that's significant. You're not going to speak on something that's minute during Super Bowl week. You're not even going to bring that up as a distraction. You're not even going to plant that seed in your head. But for you to bring it up, that tells me it's significant. And it does make me wonder, did that play a part in the injury? Because it was such a freak thing. And I will also say, look, I'm kind of a numbers guy and a stats guy. Like when we played football, I knew that if, we were starting a drive and on first down, if we got 3 yards or more, that we had, a 70% chance of scoring because we started off getting a little bit of momentum,
Yeah.
I was kind of into the analytics before the analytics, which analytics is just playing the percentages, right? And so,
Right.
like, well, what are the odds here? So, like, I want to play the odds. And here's what I do know is when Dre Greenlaw went out, I don't want to call him out by name, but his backup who came in was targeted 9 times. They were 9 for 9, Dustin.
Yeah.
And I know that guy was trying his hardest, but it's like, look, I lose a Dustin Glass on the line, my line's not going to be the same, And yeah, I mean, it just bummed me out that it came down to injuries. You want each team to be 100% and have it be, have the chips fall where they may when it's mano y mano, So that was unfortunate that had to happen, and I really feel bad for Dre. He's kind of the quarterback on the defensive side, and getting to the injuries, he's not probably going to be ready in September for week 1. Unless he does all the things that Aaron Rodgers did, then maybe he has like a 7-8 month runway. But I'd say playing linebacker is different than playing quarterback too. So he's not going to be ready week 1,
That's totally different. He went in for surgery yesterday, and he's already mentally. The reports I read, the teammates are saying he's already in that right mindset. He just can't wait to get back out. He's got a good positive mindset, so that's good to hear because we know how important that is. I looked up the stats. As of November, this article came out in November, and there were, because it was about Achilles injuries and how many we've had this year. As of November, end of November, there were 15 injuries in the NFL, Achilles injuries that took athletes out. 15.
Wow.
That's huge. And that Kirk Cousins was the last one on that article. So I'm curious. And so now 16 with, so I'm curious. There was 15 or 16. So I'm curious to see how many more happened that were not reported, obviously on that, but that's a lot. Right. And then
a lot.
Yeah. And so then I dove deeper into looking, why. Well, in the world of orthopedics, it's been a huge topic since the pandemic. Achilles injuries and surgeries are on a substantial rise since the pandemic.
That's
And
crazy.
where it's been reported, like all the big conferences in orthopedics, it's like the main, like huge topic of orthopedics of how these Achilles injuries are going up. And they're speculating, and not necessarily NFL, but they're speculating because there was so much downtime during the pandemic. Coming out of that, then got people started to get right back into being active, and most people, don't kind of gradually get back in; they just jump right in, and so we're seeing a lot more. So pretty interesting. But then the next article I came across was on the actual NFL and the injuries of Achilles, and this was a more recent one in January, and they're saying that the athletes are complaining, like we talked about the turf. 15, there's 50, it's split equal. 15 stadiums have artificial turf, 15 have grass. And it's going in the trend of everybody's changing to the turf, right?
Yeah.
And the athletes are not liking it. They want the grass. That they feel like, this is going to
Dude,
prevent
100%. Yeah.
right, because all the reasons we gave before. And so So, and then they're also seeing the NFL, obviously, Alumni Association are following, the Players Association are following the trend of the Achilles injuries as well and seeing the rise in that too. But yeah, so it's definitely being talked about. It's definitely being watched. So in the NFL, they're speculating that it has to do with some of the turf issues. They're not going to talk about, COVID or the vaccine or anything
Sure.
like that. And, take that out of the equation, let's look at, the tangibles right now.
Sure.
The turf would be one thing to start looking at. And then maybe if they're not going to change the turf, somebody's going to have to figure out some footwear or some kind of bracing or some kind of thing to protect these athletes. I don't know what that would be or what that would look like. It seems because you need all that ankle mobility, so I
Yeah.
don't know if there's anything anytime soon, but I hope somebody in the medical world and the medical device world is working on some kind of something, because I think that's the next kind of big thing, just like the cowboy collars for
Yeah.
stingers and the
Yeah.
the Q collars for concussions and all that kind of stuff. Somebody's going to figure out something for the Achilles.
It's needed because that's not a sprain. Obviously, it's a catastrophic injury, one that you could be a high level athlete, and if you don't have the right surgery or don't have the right rehab, you could literally never be the same athlete again.
Yep.
You know, lose your step, lose your vertical, lose your speed, lose your agility, lose your confidence. You know,
Well, the saying goes, about the Achilles heel, right? So
right?
there's
Yeah.
a reason for that. You cut that thing off, you injure that. It's a game changer, like you said. So it's
Yeah.
very limiting. So yeah, a lot of interesting things about that. Too bad. I felt terrible for him. We talked about him last week with the stinger,
Yeah.
that weird stinger. So he was obviously dealing with issues, these NFL guys, I watched the Kelsey story on Netflix or whatever it was,
Hmm.
ESPN, and, just seeing Jason Kelsey and talking about how hurt he is and banged up he is. And,
Yeah.
I think more people need to realize that these guys have a couple days, if that, to recover from a big game,
Yeah.
and every week's a big game for them. So
I was talking with a client this last week about an NFL veteran who's going to be a Hall of Famer. And they were asking me, how often do I go to LA? And I said, well, when I treat a younger guy, sometimes once a week. I mentioned, I was treating an older guy who'd been in the league over 10 years. And towards the end of his career, his last year, I was seeing him 3-4 times a week. He's like, what? I said, bro, damn near every other day, And I said, Sunday he plays. He's wrecked on Monday. I see him Monday and then see him on Wednesday and then see him on Friday. He's not practicing during the week very much, but then he's able to suit up on Saturday to go through walkthrough. So it took him the whole week just to get to be able to practice properly. And then he's strapped up and going 100% at the game.
yeah,
So that takes a lot of training and a lot of experience to be able to do. But yeah, it's a process those guys go through a lot. And we'll
yeah,
talk more about those injuries. I'm glad you gave me the update about his surgery. Hopefully everything went well with that. And I'm going to do a little research and see if I can find what type of procedure he had,
yeah.
if it was the same as Aaron Rodgers or if it was different. I don't know if you know specifically offhand.
Yeah, I didn't get any of those details, but he's got 15 other guys in the league he can talk to.
Right.
That's what I would do if I was him. I'd get on that list and be like, "Hey, bro, you've been
I'd have a
going through
group
this.
chat.
Yeah, you got 15 people you can go through and get notes and find the common things that seem to be working for everybody and stick with those." That's what
100%.
I would do.
Yeah. Well, I know we're up against it. I do want to mention one last thing, man. I made a joke last week that every time the Chiefs and Niners play and the Chiefs win the Super Bowl, there's a damn catastrophe that hits. In 2020, COVID hit a month after the
Yeah,
Chiefs won the Super Bowl. And so I hope nothing terrible is down the line coming for us in Q1 and Q2 and before the next football season starts. But I was kind of saying that in jest. And
right.
then something terrible did happen, which was at the Chiefs parade yesterday or day before yesterday. There was 3 shooters and one person died, and I think 20 some people got hurt, many of them kids.
Yeah, 8 of them I
What the
heard as
hell is
well.
going on, dude? What is
Yeah,
going on with people?
yeah, people are losing it. People, yeah. it's not good. Like,
dude.
when was that ever okay? Like, and they had to plan that. When, they had to think about it, they had to plan it, they had to agree to do it. So I have a lot of thoughts behind it.
No, no.
We could talk offline on that, but it's scary stuff,
Disturbing.
man. And yeah. But good for those citizens that tackled one of them down. I didn't see what happened to the other two, but
Yeah.
they got on them and held them down and got the cops on them. So that was good.
Man, I've always told my wife, we're ever in a situation, you never know if it's fight or flight, but I just, as a pre-warning, I've said, my instinct is to jump into that shit.
Yeah,
And so, like, if something happens, don't be surprised if I'm reacting,
yeah,
don't be shocked. Like, I need you to respond off that reaction, like call
yeah,
911,
yeah,
get yourself safe. Like, I can't sit and watch shit like that. And
yeah.
sometimes you just freeze. So I'm not
Right,
saying I'm a
right.
superhero, but man, those people that responded,
Yeah,
that's amazing. They
yeah.
deserve a
Yep.
lot of shit. They deserve a Super Bowl ring, if you ask me.
Yeah, good for them. Yeah, I
You know?
agree. Good for them too. I mean, because you don't know what that guy's got in mind. He could be running from one place to another and then open fire again. So
Yeah,
you gotta neutralize it. So
man, praying for those families that have to
oh my
deal with
God,
that tragedy. And I don't know what causes people to do stuff like that. I'm kind of like, if you're that disgruntled, go take yourself to the forest. Like,
yeah,
don't
yeah,
ruin other lives. Like, what the
right,
hell is going on?
yep,
So, yeah, I don't want to speak any ill will into the universe anymore. That was just a joke, and it was sad to see that happened.
yeah,
So, anyways, hopefully everybody is, other than the one death, hopefully everyone else is going to recover from that, and hopefully the people that did that are disciplined properly and put away for a long time.
yes,
Well, what's in store for this week and weekend, I should say. I know you have to go here in a few seconds, as do
yeah,
I. But
yeah. Wrap it up.
anything anything
No,
going on this weekend for you?
my one daughter went and visited her older sister in Tennessee, so she got there late last night. So I'm excited for her to she's going off to college next year, so this is kind of her maiden trip out. Get
Yeah,
to hang out with the college kids in the dorm, and my daughter lives in a dorm. She's a sophomore, but they call them dorms. But man, it's a 4-bedroom apartment with 2 bathrooms, full bathrooms,
she's
a
living.
kitchen, a living room. This is the athlete dorms, right? And
Yeah,
I'm like,
yeah,
and laundry in there. That's not a dorm. I
yeah.
had a jail cell as a
Right.
dorm. So we call them dorms, but yeah, with a carport, it's ridiculous. But
That's hilarious.
so yeah,
Good for her.
so my her sister's out there with her, and my youngest she's on the varsity softball team as a freshman, but she's a catcher, and the catcher, pitcher, and 2 others on freshmen are playing down with JV
I
also to
see.
help out because there's only so many key players, right? That
Yeah,
are core, like catcher pitcher is a huge position, right? So, anyways, so she's had 5 games this week. So she's got 2 varsity games tomorrow. She's got 1 JV today, 2 tomorrow. So I'm going to be on the field bright and early tomorrow morning. She's got a little mini tournament tomorrow for varsity, so I'm excited for her. She's doing well. They have her as a freshman. Hitting as a DH, so she's in the lineup, in the middle of the lineup, and doing well. So good
dude,
for
that's
her.
exciting. That's
Yeah.
great. Good
So
stuff.
yeah. What about you?
I'm headed out of town today. Actually, took Friday and Monday off. Had a lot of work stuff. I usually take the weekend after Super Bowl. Take
Man,
a
I want
couple
your
days.
job. I want your job, man. What
Right.
the hell?
It's my
Going on
first
vacation?
weekend off since September, really. So
I
it's
don't
nice to
know.
take off
You
for
were
a
to
couple of days.
Disneyland the other day.
That's right.
You're going, man. Don't get it twisted.
I'm
You're,
sneaking them in,
yeah,
Dustin. I'm sneaking them in, bro.
yeah. I don't know, man. You got them all fooled, but me.
Yeah. Well, I'll send
That'll
you
be
a pic from where I'm at. I don't want to speak on it,
okay.
but
Okay. Yeah.
I'll send you a pic later on. I got a 5 or 6 hour drive,
Awesome.
taking off in a couple hours. But man, I'm glad you made time. My next client actually just pulled up to the house and
Perfect.
is calling me, so I just shot him a text saying I'll be right
Hey,
down.
real quick on that,
Yeah.
I don't know if you saw on TikTok, one of our fans chimed in on that.
Oh no,
Um,
what?
yeah, they're like, "Ha ha ha! Never seen a doctor call a patient a client." And so I responded to them. So maybe we
Really?
can talk on that. I responded to it, but maybe we can talk on that next time. Let's table it for now. We can
Huh.
have a conversation offline. You can go look at what I posted, but
Okay.
yeah, I was like, okay, I gotta set because there is a difference, and there's a reason why we would call it a client versus a patient. So you can see what I wrote, but let's talk about that at
Okay.
next podcast. So
We will do that. And I'm going to ponder that on today's drive because I use those interchangeably all the time.
yeah, but there is a difference. I learned a long time ago.
Okay.
So yeah, so
Well, you'll teach me something next week.
so yeah, no, all good.
Good. Well,
All
be
right, brother.
safe this weekend, man. Give Leanne a hug and have a great weekend. Thanks for carving out time. And we'll touch base this weekend and figure out next week's schedule.
We'll do. Say hi to Kelsey and have a good one, man. Have a good trip wherever you're going. I can't wait to hear.
Yeah, can't wait to, man. Well, to
All
our
right.
listeners, thank you. Hit that subscribe button. Tell a friend. We appreciate you for participating, listening. We have a great time doing this, and we do it for you guys. So, again, thank you. Dustin, have a great weekend. Everybody else, have a great week. And be safe, be healthy. We'll be back with you soon.